But then with that, so with the health card, for example, how do you envision implementing this? If you're a taxpayer, you get a health card, but for those who don't have income and those that are not even in the formal economy, meaning yung mga nagtitinda lang sa kalye, sila yung normally walang identification, walang mga registration, how will they get a health card?
Yeah, okay. So health card kasi is, I'd like to call it the symbol of universal health care. Having a health card and making use of it is symbolic of universal health care implementation. But let's shift to how that health card can be actually used. And that the assertion is we have the money, and in fact we're spending the amount that's there. My computation is around 1.5 trillion. 1.4 ang sinasabi ng economists, but that's my estimate, around 1.4 to 1.5. But when you say that, the money is there because if you translate this is roughly 13,000 per person. The World Health Organization suggests that in fact you only need 8,000 per person to have a good funded health system. Of course, countries like Singapore have 200,000 per person, while the very poor have much less. But the Philippines is on average. The money is there. Now, what are the changes that we want to emphasize? The money is there, but more than half, as Dr. Eric has pointed out, comes from out of pocket. So if you're rich, like you're saying, the middle class, they can afford out of pocket. But if you're poor, out of pocket will wipe you out. It's very catastrophic. So that's the first correction. The money is there, but it comes from out of pocket. We want that to be reduced. We have government funds, Philhealth funds. The DOH has a budget of more than 200 billion. If this can be put into the pot, the universal health care calls for a pooling of resources. Because if you get a need for health care, you have to go to your barangay, your mayor, SSS, PAGCOR, your affluent. Instead of having to go to so many places, universal health care aims to pool all of these together. So the money's there, how we use it, where it comes from, that's a challenge.